everyone. We are Group 3 presenting the financial model for diabetic monitoring device. My name is Devika Bharti and my team members are Akhil Madhuri, Saroj Tamak and Visita Reddy. Technology advancement has shown phenomenal change in every field and similarly in the health sector too. We are looking for the diabetes. What is diabetes? Diabetes is a disease of high blood glucose level, or we can say that less level of pancreas production in the human body cause diabetes. There are four types of diabetes. Type 1 diabetes. It is mostly seen in the children when pancreas production is insufficient, and type 2 diabetes is mostly seen 90% of the people due to the high blood sugar level in the human body. And the pre-diabetes, it is similar to type 2 diabetes, but it is the beginning stage of type 2 diabetes. And the gestational diabetes, it is mostly seen to the pregnant woman. Let's see another slide. Here we are looking at the facts and figures. According to Australian Institute of Health and Welfare, 1.2 million people are suffering from the diabetes and they have been hospitalized, where 1,600 deaths has been recorded due to diabetes. Looking at the future market by 2025, we know that Australian diabetes market is going to increase by 2.44 billion and the type 1 and type 2 diabetes is going to be seen in 1 million Australian people. And for that, we have Australian care device is going to increase by 0.7 by 2025. Moving to our next slide, we have project method, primary data method and secondary data method. For our project, we have chosen secondary data method by collecting the questionnaire to our client, Mr. Dirk. Let's go to the next slide. We have current market testing scenario. First market testing scenario is pathological lab testing. Here we can see in image that doctor and patients are interacting with each other and taking the blood samples. It is lengthy time. It is mostly considered as 3 months time frame. It is cost within the $450. And in the second image, we can see that patient is finger pricking. They are self-testing. There they need to record the information by themselves, which is known as self-reporting, and the device costs around $300, and it is also a lengthy process.
Hi guys, so this is Saroj Tamang and I'm doing my part. So as my part, what was a really interesting part about this process, this project was we found out some research findings. Like one of the research findings that was really interesting was the current diabetes monitoring system or the current market. It's really complex, time-taking, and costly system. And in comparison to that, the annual cost for Australians with type 2 diabetes comes to 6 billion annually, which is expected to rise more. And with this, what we can see is this system has not been able to provide a quality lifestyle for the general public in Australia, and due to which we see there is a market gap and opportunity available for a diabetic monitoring device in this current scenario. And what we tend to see is if you can cut the gap between doctors and patients and removing all the middlemen, what exists, we can build up a more effective system, giving both patient and doctor more easier way to connect. Next slide, please. And with this one, with the proposed treatment, what we are trying to say is it's mainly based on cloud storage, or you can say a cloud technology. So how it works is a diabetic patient provides with our device, with a sensor device, his information or data, his blood glucose level, and it goes to a medical center. And from that medical center, it goes to a doctor. With the doctor, he makes his analysis and he can provide the necessary prescription and food changes in a real time. So what happens is there is a instant feedback and instant connection with doctors and patients. So you don't have to, just sit back and just wait for your result. And the whole thing is quite simple. Yeah, next please. So the proposed device that we are proposing is Home Diabetic Manager. So this one, it just analyzes your blood sugar level with just one touch, which is easy, simple, and affordable for the whole household. And communication between doctors and patient can be anywhere, anytime. This is a non-finger pricking blood extraction method, which is a secure and private health record, which it maintains and maintains that secure and privacy for you. Thank you. And I'll pass to my next teammate.
Thank you, Saroj. Hi, now my product, this is about the new product development. In the new product development, it consists of the several systematic methods that guide product innovation and development. And a new product development increases the competitiveness in the market and fill the opportunities. While coming to the diabetes management, products are innovated, and the new products are faster and efficient in production. The increased competition in the product managing diabetes also gives the necessaries for the innovation and development. Here in the picture, we can see the process of which involves the upstream and the downstream process. And while in the upstream, it discusses about the research, development, design, and supply. These are more costly regarding the new development product. While in the downstream, it costs less marketing, distribution, and customer service. And in this, we have three development process. One is the front end, other one is the technological road, the third one is the portfolio management. While coming to the front end, it discusses about the new goals of IoT devices. For the technological roadmap, it ensures that the IoT devices are well adapted to the market by relating the technological and market needs. While coming to the portfolio management, it discusses about the IoT devices which meets the goals and objectives which are already developed. While coming to the SWOT analysis, the SWOT analysis of strength describes about the real-time monitoring, alerts the future in case of emergency. It is portable. And while coming to the weaknesses, these are not fully automated. It lacks of insurance. High cost is demonstrated for the build-up of this machine. And we have many number of opportunities like provide healthy lifestyle, cheap to use, and it's reliable. The threats from the diabetic manager are these are highly competitive. Breach of security can happen to the technology. Reversal to the traditional method. Thank you, and we'll continue by Rishita.
Thank you so much, Akhil. And now I'm actually presenting about financial modeling. It is of two different types. One is imports and one is locals. So here I'm actually showing about the budgeting, cash flow, and income statement of 5 years. So looking at this, we can actually do data analysis. So data analysis which have been found from these are imports have a better quantity as the labor and overhead costs are less comparative to the locals, and the price is being less. Quality is better with locals as they have met with the local standards, like they have met the known local standards. And looking at the labor cost in both imports and locals, the labor cost has been higher percentage in locals with 10 to 15%, and imports have their local percent at 2 to 5. So all the imported products will cost us less comparative to the manufactured ones in Australian made product, which is being regulated by authorities analysis. So here locals is nothing but the Australian made product, and imports is nothing but the ones which we're getting from outside. Looking at both of them and data analysis, we could find an IoT based commercialization strategies. So there are 4 different types of strategies. First one, software as a service. All cloud-based server costs are being considered as software as a service, which has been web application, cloud server support, and development. Hardware as a product. All materials and product maintenance, product cost, product maintenance, sprite, etc. comes under hardware as a product. PaaS, platform as a service. Device which is being reached out to the customer. So, it's just a fingerprinting, not a fingerprinting one, just a touch. So that, this is how the device is being reaching out to the customers. And the last one is hardware as a service. Platform which acts as a connection between patients and doctors. So this is hardware as a service. And coming up to the recommendations, after viewing about the project, looking at the graph, it is how the Australian government is spending more than 1 billion over 4 years from 2018 to 19 to support the Australian diabetic patients to get them self-managing their conditions. So government and companies, both of them are being more focusing on curing diabetics. That's the reason there is an increase in expenses for the diabetic patients to manage. So rather than focusing more on curing the diabetics, it is better to provide a consistent diabetic monitoring system. So we have created a device which can be easily being tested with getting a glucose level anywhere, everywhere, at whatever time they want, with a very low cost. Coming to the conclusion, so here we conclude with saying that, right now Australian government market analysis is not so efficient for a longer time in a health market. That is the reason we have created a new product device, home diabetic manager, which is efficient for the customers to use it. This is a non-invasive one, which gives the instant feedback with a very great innovative product with a less efficiency. So this can go high in the market because of more innovation in the product and less effective uh, in nature. So this is why this can get in demand with the cost efficiency. So therefore, I could conclude by saying that, the product is getting more profitability for the patients as well as for the investors in the Australian diabetic market. And here are our references which have been created for all the PPT slides.
Thank
Thank
you
you
all.
so much.